Welcome back to NTV News First Edition. It would be an understatement to say it's been a rough 16 months. We've experienced anxiety, COVID fatigue, and languishing, and we're now hearing reports of a large number of frontline workers like nurses and teachers who are leaving their professions. Workplace burnout has always been an issue, but perhaps it needs an extra discussion. Here to explain workplace burnout is Dr. Janine Hubbard in this week's segment of Get Psyched with Dr. Janine. Thanks for being here.
Thanks for bringing me in. This one's a hot topic for sure.
Literally, yeah. I mean, we hear about burnout. We all talk about it. Just wrap it up for in a bow for us. What is it?
Sure. I mean, we all mention it casually, and it's not the I've had a rough week, I'm tired on a Friday. What we're looking at here is a chronic condition that develops very gradually, so we don't notice it creeping in, but they've kind of found three fundamental issues. What you're feeling is pervasive physical and emotional exhaustion, cynicism, detachment, lack of interest in a job that you were previously really passionate about, and then the third is just not being as productive. And we're seeing that trio of symptoms. Like I say, it often creeps up gradually, but that is the hallmark when it happens over a long period of time of workplace burnout.
So if it creeps up gradually, then it might be hard to see the cause. How do you identify it? What causes it?
Well, we know that there's a variety of both individual factors that put you at risk as well as institutional factors. So as I mentioned, from an individual perspective, actually not being great with work-life boundaries and, you know, being the person who is so dedicated to their job and working through lunch and not necessarily setting those boundaries and taking on more work, that's going to put you at risk for sure. And then institutionally, the biggest one we know is lack of resources. So if your employees are feeling chronically overworked, that's a huge thing. But also if they're feeling undercompensated, under-recognized, undervalued, and not respected, that combination of factors can lead to this level of burnout that we're talking about.
So, you know, you've talked on what causes it, but when we talk a little bit about what the employee-employer relationship here, oftentimes we feel this as something that we wear as employees, but there's also a role for both here, right? How do you address this?
Absolutely. And certainly if there are employers out there, there's some wonderful resources available to help try to address these issues. Biggest thing I can say is start talking to your employees. One of the other factors is decisions being made that directly affect employees that they have no say about, and boost up your employee mental health, psychological support, because from an individual factor, making sure you're engaging in self-care, making sure you are, again, learning how to set some of those more appropriate boundaries, and taking care to establish that work-life boundary that often needs some counseling and psychological support. From an institutional perspective, big things are making sure that your employees have a reasonable, sustainable workload, and that they feel respected, that their skill set is respected, that they're given autonomy to practice to full scope of whatever it is that they're supposed to do, and making sure that there's really clear role delineation in terms of who does what and who has the skills to do what. The research is showing that those are really important factors moving forward.
Okay, there is so much to hit on there. And finally, you know, when we talk about work from home, a lot of people, you mentioned about, you know, checking your emails at night, and people who are really invested in their work, you can't sometimes pry themselves away from it. So it's not something to feel guilty about, but recognize.
For sure. And like I say, this is why using this opportunity at this stage of the pandemic to say we are seeing people at increased risk, because the pandemic has just added that extra level of increased stress and duration. And again, we've seen, you know, lack of resources in a lot of fields. So please, this is the time, if you are starting to feel it as an individual, address it. It's time to, you know, reach out for that help. If you're in a position you're comfortable with, start talking to the employer. Employers, please, these are the last people you want to lose. These are your highly trained, highly invested, really passionate employees that you're at risk of having them either be less productive, unhappy, mentally unwell, underproducing, and at risk of leaving your organization.
Always simplifying very difficult topics. Thank you so much for this conversation, Dr. Hubbard.
Thanks, Jody.